Hi everyone, welcome back to our channel. Today, we're diving into an important health topic that affects millions of people worldwide, fatty liver disease. If you or someone you know is dealing with this condition, stay tuned as we discuss what fatty liver disease is, its causes, the signs to watch out for, and most importantly, how you can reverse it. If you're new here, make sure to hit that subscribe button and click the bell icon so you never miss any of our health and wellness tips. What is fatty liver disease? Fatty liver disease, also known as hepatic steatosis, is a condition where excess fat builds up in the liver. Now, why is this a big deal? Well, the liver is your body's detox powerhouse, processing nutrients, filtering blood, and fighting infections. But when it gets clogged with too much fat, it can't do its job properly, leading to inflammation and even serious conditions like cirrhosis or liver cancer. Types of fatty liver disease. There are two main types of fatty liver disease. 1. Non-alcoholic fatty liver disease, NAFLD. This type occurs in people who drink little to no alcohol. It's the most common form and is often linked to obesity, diabetes, and metabolic syndrome. 2. Alcoholic fatty liver disease, AFLD. As the name suggests, this type is caused by heavy alcohol consumption. Fatty liver disease can range from simple steatosis, where there's fat accumulation without inflammation or liver damage, to non-alcoholic steatohepatitis, NASH, which involves liver inflammation and damage. Causes of fatty liver disease. Non-alcoholic fatty liver disease, NAFLD. NAFLD is often associated with obesity. Excess body fat can lead to fat accumulation in the liver. People with a body mass index, BMI, over 30 are at higher risk. Insulin resistance. Conditions like type 2 diabetes and metabolic syndrome can cause insulin resistance, leading to fat buildup in the liver. Insulin resistance means that cells don't respond well to insulin, causing higher levels of insulin and glucose in the blood, which promotes fat storage. High-fat diets. Consuming too many unhealthy fats, particularly trans fats and saturated fats, can contribute to liver fat accumulation. Diets high in processed foods, fast food, and sugary drinks are particularly detrimental. Genetics. Your genes can play a role in your susceptibility to NAFLD. If you have a family history of liver disease, you might be at higher risk. Certain genetic mutations can influence how your body stores and processes fats. High cholesterol and triglycerides. Elevated levels of cholesterol and triglycerides can contribute to fatty liver. These fats can accumulate in the liver when they're present in excessive amounts in the bloodstream. POS, polycystic ovary syndrome. Polycystic ovary syndrome is another risk factor linked with fatty liver due to hormonal imbalances and insulin resistance. Women with PCOS often experience metabolic issues that increase their risk. Alcoholic fatty liver disease, AFLD. AFLD is primarily caused by excessive alcohol consumption. Drinking large amounts of alcohol can interfere with the liver's ability to break down fats, leading to fat accumulation. Alcohol metabolism produces substances that can damage liver cells and promote inflammation. Other contributing factors to both types include malnutrition. Poor diet and nutritional deficiencies can exacerbate fatty liver. The liver needs various nutrients to function properly, and deficiencies can impair its ability to process fats. Medications. Certain medications like corticosteroids, some cancer drugs, and others can increase the risk of fatty liver. Always consult with your healthcare provider about the potential liver-related side effects of any medication you take. Rapid weight loss. Rapid loss of weight can sometimes cause fatty liver due to the stress it places on the liver. This can occur during extreme dieting or after bariatric surgery, as the liver processes the sudden influx of fats from breaking down body fat. Signs of fatty liver disease. Fatty liver disease often has few or no symptoms in its early stages, but as the condition progresses, you might notice the following signs. 1. Right shoulder pain. Surprisingly, shoulder pain can be linked to liver disease. This occurs due to referred pain, where the liver inflammation irritates the nerves that run to the shoulder. It's important not to ignore persistent shoulder pain, especially if you have other risk factors for liver disease. 2. Belly fat. Excess fat around the abdomen is both a risk factor for and a symptom of fatty liver disease. This central obesity is particularly dangerous for metabolic health. Belly fat can increase the likelihood of developing other conditions such as cardiovascular disease and diabetes. 3. Rib pain, costochondritis. Pain in the rib area, particularly on the right side, can be a symptom of liver problems. This pain can be due to liver enlargement pressing against the ribs. It may be mistaken for other conditions such as rib injuries or heartburn. 4. Spider veins, angioma. These small, spider-like blood vessels visible under the skin can indicate liver dysfunction. They're caused by increased estrogen levels, which the liver can't process effectively. Spider angiomas can appear anywhere on the body but are commonly found on the face and chest. 5. Gynecomastia. Men with fatty liver disease might develop gynecomastia, which is the enlargement of breast tissue. This is due to hormonal imbalances, particularly an increase in estrogen. Gynecomastia can be distressing and may require medical treatment or surgery in severe cases. 6. Swollen right foot. Edema or swelling, particularly in the lower extremities like the right foot, can be a sign of liver disease. This is due to the liver's impaired ability to produce proteins that regulate fluid balance. Chronic swelling should always be evaluated by a healthcare professional. 7. Itchy hands/feet. Itchy skin, especially on the hands and feet, can be a sign of liver disease. This is often due to the buildup of bile salts under the skin. Persistent itching can lead to skin damage and infections. 8. Low thyroid. Hypothyroidism or low thyroid function is often seen in people with fatty liver disease. The metabolic slowdown can contribute to weight gain and further fat accumulation in the liver. Symptoms of low thyroid include fatigue, weight gain, and depression. 9. Constant fatigue. Persistent tiredness and lack of energy are common signs, as the liver's ability to detoxify the blood is compromised. This fatigue is often disproportionate to physical activity levels. It can significantly affect daily life and productivity. If you experience any of these symptoms, it's important to consult with a healthcare provider for proper diagnosis and treatment. Early detection can prevent the progression to more severe liver disease. How to reverse fatty liver disease. The good news is, fatty liver disease can often be reversed with lifestyle changes. Here are some effective strategies. 1. Healthy diet. Eat a balanced diet. Focus on whole foods like fruits, vegetables, whole grains, and lean proteins. Incorporate foods that are high in fiber, such as legumes, and avoid processed foods. A diet rich in antioxidants, such as berries and green leafy vegetables, can help reduce inflammation. Avoid unhealthy fats. Cut back on trans fats and saturated fats. Instead, opt for healthy fats like those found in avocados, nuts, and olive oil. Omega-3 fatty acids, found in fish, flax seeds, and walnuts, can be particularly beneficial. These fats can help reduce liver fat and improve heart health. Limit sugar. Reduce your intake of sugary foods and drinks, which can contribute to fat accumulation. Watch out for hidden sugars in packaged foods and beverages. High fructose corn syrup, commonly found in soft drinks, is particularly harmful to liver health. 2. Exercise regularly. Physical activity. Aim for at least 150 minutes of moderate intensity exercise each week, such as brisk walking, cycling, or swimming. Consistent physical activity helps burn triglycerides and reduce liver fat. Incorporate activities you enjoy to make it easier to stick to a regular routine. Strength training. Incorporate resistance exercises to build muscle and improve metabolism. Muscle tissue burns more calories at rest compared to fat tissue, helping with overall weight management. Aim to include strength training exercises at least twice a week. 3. Weight management. Lose weight. If you're overweight or obese, losing just 5 to 10% of your body weight can significantly reduce liver fat. Even modest weight loss can have a substantial impact on liver health. Work with a healthcare provider or nutritionist to develop a safe and effective weight loss plan. Slow and steady. Avoid rapid weight loss as it can sometimes exacerbate fatty liver. Aim for a gradual, sustainable approach to losing weight. A slow weight loss of 1 to 2 pounds per week is generally recommended. 4. Limit alcohol intake. Reduce consumption. For those with AFLD, cutting down or completely avoiding alcohol is crucial. Even for NAFLD, Limiting alcohol can help reduce liver stress and improve liver function. If you find it difficult to reduce your alcohol intake, seek support from healthcare providers or support groups. 5. Medications and supplements. Consult your doctor. In some cases, medications or supplements may be prescribed to manage underlying conditions or support liver health. For example, medications for diabetes or cholesterol management can indirectly benefit liver health. Some people may benefit from vitamin E or omega-3 supplements, but these should only be taken under medical supervision. Vitamin E. Some studies suggest that vitamin E supplements may help reduce liver inflammation, but always consult your healthcare provider before starting any new supplement. Excessive use of vitamin E can have side effects, so proper dosing is important. 6. Monitor your health. Regular check UPS. Keep up with regular medical checkups and follow your doctor's advice to monitor and manage your liver health. Blood tests and imaging studies can help track progress. Regular monitoring allows for early detection of any worsening of the condition. Stay informed, educate yourself about fatty liver disease, and stay updated on new research and treatment options. Knowledge is a powerful tool in managing your health. Join support groups or online communities to connect with others who have similar experiences. 7. Stress management. Mental health. Chronic stress can negatively impact liver health. Practices such as yoga, meditation, and mindfulness can help manage stress levels. Consider activities like Tai Chi, deep breathing exercises, or hobbies that you enjoy to help reduce stress. Sleep. Ensure you get adequate sleep, as poor sleep can contribute to weight gain and insulin resistance, exacerbating fatty liver disease. Aim for 7 to 9 hours of quality sleep each night. Establish a regular sleep routine and create a relaxing bedtime environment. 8. Hydration. Drink water. Staying hydrated helps your liver function properly. Aim to drink at least 8 glasses of water a day, more if you're active or live in a hot climate. Proper hydration supports overall health and aids in digestion and detoxification processes. 9. Reduce toxins. Avoid exposure. Reduce exposure to environmental toxins and chemicals that can stress the liver. This includes avoiding smoking, limiting exposure to pesticides, and choosing household products that are free from harsh chemicals. Fatty liver disease is a common but serious condition that can often be reversed with the right lifestyle changes. By maintaining a healthy diet, exercising regularly, managing your weight, and limiting alcohol, you can take significant steps towards a healthier liver. Remember, reversing fatty liver disease is a gradual process that requires consistency and commitment. The benefits, however, are well worth the effort, leading to improved overall health and a reduced risk of more serious liver conditions. If you experience any symptoms of fatty liver disease, such as right shoulder pain, belly fat, rib pain, spider veins, gynecomastia, swollen right foot, itchy hands or feet, low thyroid, or constant fatigue, consult your healthcare provider. Early detection and management are key to preventing complications. Incorporating these lifestyle changes not only improves liver health, but also enhances your overall well-being. From enjoying nutritious meals to engaging in regular physical activity, these steps contribute to a healthier, happier life. Thanks for watching. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you don't miss any of our future videos. If you have any questions or topics you'd like us to cover, drop them in the comments below. Take care and see you next time.